Now, numerous bones. এত ছোট ছোট হ্যান ত্যান মনে রাখতে হবে ওই ওই you have to know the keystones and the function of an articulated foot. You have to know the skeletal elements and its function. And I told you earlier, the evolution of erect posture, when I taught vertebra or something like that. Now, we were like this. Like this. Now, slowly with evolution, we have become erect. Naturally, even now, with foot, you cannot catch a pen. Of course, I'll tell you that when you can. You cannot catch a branch of a tree. You cannot catch the handle of the bus or the metro. In a running bus or running train, it just, you went for a something in the platform, or you just had a long journey. So I say, train suddenly it whistles in us, and you start to run, and then you catch the handle. You don't catch. You put your foot first. You put the foot in the train or the step. Now this is the action which demands, and that is why the anatomical difference between an articulated hand and articulated foot. Okay? Whenever you are learning, now don't leave this. Ajke khatam karo eta. I'll be here. I will leave you for 1 hour to see that video and also see the skeleton. Or when you are coming on the dissections, I think tomorrow or tomorrow, then you see the skeleton there and listen to the teacher, whatever he is teaching you, the sole or the foot will be taught to you, dissected, and the different layers of the foot. And according to the function of the foot, that you are standing long hours. Okay. Now, that how it is without so much with so much pressure, and you have a bag, you don't get a ticket in Santiniketan Express. Then you travel to Kolkata or Bardhaman. Up to Bardhaman, you are standing for 1 hour or 2. And in future, when you become a established doctor or surgeon or this thing, you have to do many operations 2 hours standing. Or you have numerous operations. For 3 hours, you will be standing, walking, and again going through. So that load has to be kept, and that the cushion is there. And see, I wear a suit of Raymond's, okay, a signature company, brand, but my chappal is XYZ company. You are buying a suit for 15,000 or 20,000, just I'm saying this thing, but you are buying a shoe. The trend is now buying shoes at cheaper price. How much offer? 2,000 discount, buy one get one free, 999. That has that the shoes hold the foot, so naturally the sole and the material used counts. Now what I want to say is that you have to know the bones first. So how you remember? Now, Bones and sole of the foot. Bones and sole of the foot. What are the bones? Now organization, how to draw talus, calcaneus, middle unit, 5 small tarsals, metatarsals, arches, ossification. তুমি এই 5টা স্লাইড তোমরা দেখো, তারপরে তুমি ওসব মেলাবে, মেলাবি পরে বাড়িতে গিয়ে মেলাবি, ডিসেকশন হলে মেলাবি, যখন এই ডেমনস্ট্রেশন হয়ে যাবে না, তারপরে ইউ হ্যাভ 1 hour, কারণ আমার ডিস্ট্রাকশন হচ্ছে। তুমি দেখো এগুলো, এই 5টা স্লাইড এখানে সেভাবে নেই, কোথাও নেই, গ্রেজেও নেই, it is not in Gray's even, but it is in Grant's anatomy. So I'm picked up, see, now bones of the articulated foot is key, talus, calcaneus, middle unit, small tarsals, metatarsals, arches, ossification. Identifiable parts in living foot: sole of the foot, articulated foot from below, it is like this. First layer is the skin, the plantar fascia, the aponeurosis, cutaneous nerves. When they will be demonstrating you or showing you in dissection, the skin inside, and then it like the palm of the hand. It was demonstrated to you. It's similar. It's a similar pattern, because এই থেকে এই হয়েছে, এটা কনসেপ্ট রাখবে। তাহলে কি কি আসতে পারে, what are the things are layers from anterior to posterior, similarly from below upwards. Okay, now plantar muscles, first, second, third and fourth layer. The plantar muscles, first layer, second layer, third and fourth layer. Like you have 4th layers, long tendons and skeletal plane. The long tendons on skeletal plane. Peroneus longus, tibialis posterior at the anterior and anterior, lateral plantar artery, deep plantar arch and lateral plantar nerve, medial plantar nerve, artery and nerve, door of the foot, rearrangement of tendons, and comment on vessels and nerves. This is the framework of the total foot, what things has to be focused on. Okay? Actually, what I want to do, you build up a concept. Layers of the foot. So, the skin, and then plantar aponeurosis, plantar fascia, all this, fat, nerves, vessels, and then these tendons which are going, they are inserted in the bones, and according to the function of the your bones and the tendons, that the action. So now this is the thing that I want to tell you is, see this picture. You divide the foot half, outline of the foot. These are the bones. Now, as an aid for beginners to the names and relative position of the 7 tarsal bones. 7 tarsal bones. Now, calcaneus, cuboid, and 3 cuneiforms, navicular and talus. And the accompanying design has been found useful right foot dorsal aspect. Okay. Now, you see, you draw a C like this. Then the talus is on top of the C. Okay. Now, navicular. And then 3 cuneiforms. And this is the cuboid. This is the cuboid. Now, see, this is the calcaneum, this is the cuboid, talus, this is the cuboid, this is the your the calcaneum, talus, navicular, 3 cuneiforms, and this is the cuboid. Now, you see, জাদু এরকম আমারও ঘুম হয় জানিস তো আমি প্রেসক্রিপশন লিখতে লিখতে লেখা হয় এটা হয় হ্যাঁ লেট আস ইউ সি অ্যান্ড ইউ প্লিজ হ্যাঁ ওটা ইউ সি ডোন্ট কিপ ইট ইউ হ্যাঁ হাতে নাও হ্যাঁ you feel it, okay. After seeing it, you please pass it. Now you see, this is the dorsal aspect of the foot. Now, 3 cuneiforms, cuboid, navicular, talus, and this is the calcaneum. হয়ে গেল from medial to lateral. Medial to lateral বলবে, from posterior to anterior bolbe. So I want you people, when you ask for lower limb histology, osteology, the examiner asks you, you pick up. You will be taking the femur. You will be taking your key bone eta hip bone. You might take the tibia, but you pick up the foot. You have to just tell, you rattle. Sir, calcaneus, talus. Okay, now you see, and this foot you draw is anterior, mid, and posterior. And see, this is the 3 cuneiform. Your 3 cuneiforms, the calcaneus, talus, navicular, and cuboid. See, this is the design. সহজ হলো? হ্যাঁ ঠিক আছে সহজ হলো খাতা বার কর লেখ এটা লেখ এগুলো বলবো কেন বারবার বলছি you draw that diagram, you practice একটার উপরে একটা পাট চাপা মাথার উপরে খাতা কই এই বডিতে বডি আর্ট করলে হবে না, it is temporary. This okay, you এই তোর খাতা কই উফ এগুলো বলতে হয় বাপরে বাপ আমি ফেড আপ আরে যত স্কেচ করবি না যত ড্রয়িং করবি যত লিখবি ততই ইউ আন্ডারস্ট্যান্ড বুঝতে পারছো ইউ আর ফ্রম দার্জিলিং বরফ পড়ছে তো এই দার্জিলিং এ এত বাঙালি যায় তুই বাংলা শিখছো না Now you have to know because your posting will be in Sundarban. Among the tigers. Okay. Holo, Mukhosto, holo. আমি তোকে জিজ্ঞেস করছি, এবার ছবিটা এখানে এখানে পাবি না, আবার ডাউনলোড করতে হবে কোথায়, সময় নষ্ট করবি। এখানে জাস্ট ড্র দ্যাট ফিগার, you just draw that figure, or in your the book you are reading, Bishram Singh, Chaurasiya, anything, you add a slip paper and pin it. And also when you are doing class, you draw this, একটা ঢুকে যাক মাথায় হলো। Now see, this is the mid portion. The mid portion, the anterior portion is this, and the posterior. Now this is the talus, this is the calcaneum, and see, this is the navicular, three cuneiforms, cuboid. And you see now the lateral aspect of the talus and calcaneum. This is the now lateral aspect of the talus and calcaneus. A probe may be passed like the arrow through this, traversing the tarsal tunnel, which is filled with interosseous ligament. This tarsal tunnel. This is the tendo-achilles in the calcaneum. Now, lateral aspect of the talus and calcaneus, a probe may be passed through the arrow, traversing the tarsal tunnel, which is filled with interosseous ligament. This is the part of the sustentaculum tali, this portion, jutting out, this portion. You see in the foot, medial to lateral you go, and you see flexor hallucis longus below this sustentaculum tali. Hallucis longus, the grade 2, this goes into this. And now again the base of this is metatarsal, individual metatarsal of phalanges we don't ask. But you articulated foot, you have to say the bony architecture of the foot. So you say phalanges from calcaneum, talus, and your navicular, cuboid, and three cuneiform, and 3 cuneiforms and 1 cuboid. This is the main thing. Then metatarsal. Now metatarsal bones. Now see the 5 metatarsal. Now a person comes to your chamber or in the hospital outdoor with a complaint, sir, from yesterday I am having a pain in this lateral aspect of the foot. I cannot walk. Then you ask that person what job he does. You say, I'm military mein hai. Bangladesh border or China border mein duty karte hai. So long standing, those who are standing long in the traffic police or any police, and even you surgeons or doctors, there's a common thing, a base of the 5th metatarsal bone injury, or there's a fracture, stress fracture that can happen. That's why I'm telling you, you wear a proper shoes. Oh, of course, or a party and all, you take a heel, but that actually for that period when you are young, you're having this much big heels shoes. But nowadays there's I think less use of the pencil heel. Of course, on special date, a Valentine's date, you can wear. But for your regular use, you have to think twice. Okay. And that, now, this is the base of the physical, you order for an X-ray or radiograph, I would use that term, radiograph. X-ray तो हम common लिखते हैं. लिखो, हाँ, that you have to this thing, but you think there is a radiograph. The terminology. X-ray is the ray that Ranjan discovered. So, but anyway, it's age-old practice writing X-ray. Hey, X-ray बोलो दो. And a 90 years professor is saying X-ray बोलो दो. So you are under X-ray बोलो दो, X-ray. So anyway, now what I want to say is that this you know, and see, this is the thing, 1, 2, 3, 4, 5 metatarsals. Now this is the foot is not an inert masonry arch, it is a spring. Now the medial and lateral longitudinal arches, the calcaneus is a common to both. See, lateral, medial, lateral, medial. Now arch, this is the arch, this is the idea. Now this, see, this is the arch. Now you see this is a bit flat. Now this spring, now the ligaments and your tendons and all, that supports the arch. That's why in what happens in now during Lakshmi Puja, it's a common practice of doing alpona with white color, and this, especially Santiniketan is famous for this art, alpona art. So in Lakshmi Puja, actually this type of foot is drawn. You see, that means a long trail for 10 feet. So to this thing, you're worshipping and calling Lakshmi, that you please come to my home and bless my home. That the foot imprints, that is in there. Now, it has no relation with this anatomy, but it has some relation. Now, what I want to say is that this impression will differ if you experiment. You put some color paint on your foot, and everyone, you take one piece of paper and take alta, and you see the difference of each foot. Each foot means individual, each individual. The foot impression, some it will be a bit this thing. That means it's showing the arch of the foot, how it is. Okay. Now the articulated foot, I told you the bones, the total bones are there. This is the talus, this is calcaneum, substanticulum tali, this is navicular bone, this is intermediate cuneiform, first metatarsal. These are the phalanges, distal, middle and proximal phalanges. Now, this is the whole bony unit. Now, functions of the arches of the foot. Now, proportional distribution of the body weight. That's what I was telling you, the foot. Now, the impression, Lakshmi's foot. Now, each one is having a different arch. Each individual is different. And now, the flexible lever for forward propulsion, protection to plantar vessels and nerves, acts as shock absorbers during jumping and jolting. Now, if you see, for hours, someone is dancing, or a trainer, a dance trainer is training, ऐसे करते रहते हैं. So he doesn't complain of pain Or there's a show for 4 hours. A team is dancing. Of course, the main key dancer is bit ऐसे ऐसे कर देते थोड़ा. The whole team is dancing. Or you see the show, reality shows, Saregama and all the India Idol and all this. You see, the key person is doing. That means that arch and pain, but he doesn't come and say, "ये थक गया, मेरा foot देखो." ये नहीं कहते हैं. Say, now it is the shock absorbers during jumping and jolting. That the cushions are there, the ligaments are there, and the vessels, the nerves and vessels. When you see the blood supply and nerves. Now, arches of the foot, medial longitudinal arch, lateral longitudinal arch, and transverse arch. Medial longitudinal arch, lateral longitudinal arch, and transverse arch. Now, see, medial longitudinal arch is comprised of bones, calcaneum, talus, navicular, 3 cuneiforms, and metatarsals. Metatarsals, first, second, and third. Summit, trochlear surface of the talus. This is the summit. This trochlear surface. Anterior pillar, heads of the metatarsal. The anterior pillar. It's like this. You see, when you barefoot, you can feel it. So the head is, you go to the hostel and you see for yourself that you can feel it. The head of the metatarsal it is resting on, not on the phalanges. Now what if it was on the, not on the arch? Now I would say these are the phalanges. These are the phalanges. This is the head of the metatarsal. But if this was not the case, then will be you're on toes. The toes, you're on the toes, you're on toes, you're on your toes. And your total, in the anterior portion, this portion is the medial longitudinal arch. Now the keystone, head of talus. This is the keystone of the head of talus. Key joint, the key ligament, spring ligament, more bones and joints, more resilient. Now more bones and joints. Joto joints and this thing, the foot is in such a thing, it is not like the knee joint. So that is more resilient, means it is like a spring action. Okay. Now lateral longitudinal arch. This is the lateral longitudinal arch, cuboid, fifth metatarsal. See, and you see the ligaments, how they are being attached on these ligaments. That's coming from the anterior and posterior compartments of the leg. Now, this is the articular surface that is articulating with the foot, the tibia, the lower end of the tibia, articulating with the talus. Okay. Now transverse arch, each foot presents a half arch. Complete arch is formed when both feet are approximated. So it is the now see, now the arch, it is like this. Both the foot are the thing, that the arch is completed. Okay. Now transverse arch of the foot. See, this is the transverse arch. This is a cut. This portion is cut. It is cut. Yeah. The metatarsal bone. Okay. Now, maintenance of the arch. What is the maintenance of the arch? Shape of bones, intersegmental ties, this, tie beam, this is tie beam, suspension, this is suspension. Now, you see each of these ligaments, shape of the bones. Now, this is the staples here, intersegmental ties, intersegmental. Tie beam, it's a tie beam here. This is the tendon of flexor hallucis longus. That is the tie beam. Flexus hallucis longus. Hallux is the great toe. So the tendon is coming and then going through the sole and putting, it's inserted on the head. Okay. Now, maintenance of medial longitudinal arch, shape of bones wedge-shaped, intersegmental ties, spring ligament, tie beams, plantar aponeurosis, flexor digitorum longus, flexor digitorum brevis, flexor hallucis longus, flexor hallucis brevis, abductor hallucis. Now, these are the muscles, tendons that is supporting, and it is in the this all flexors, the plantar aponeurosis. The plantar aponeurosis, when you dissect, it will be thing. You will see then below that flexor digitorum longus, flexor digitorum brevis, flexor hallucis longus, flexor hallucis brevis, abductor hallucis, suspensions, tibialis anterior and posterior. Now the suspension is the tibialis anterior and the posterior. The arches are maintained. Maintenance of longitudinal medial and longitudinal arch are now see maintenance of medial and longitudinal arch. These are the muscles. Here, tibialis posterior, tibialis anterior, and flexor digitorum longus, flexor hallucis longus. Now, maintenance of lateral longitudinal arch, shape of bones wedge-shaped, intersegmental ties, long and short plantar ligaments, tie beams, plantar aponeurosis, and these are the tendons. Suspension is the peroneus brevis and peroneus tertius. This will be all shown to you in dissection. Maintenance of lateral longitudinal arch. These are the tibialis anterior, extensor digitorum longus, extensor hallucis longus, these. And see peroneus tertius, peroneus brevis, and this is the lateral malleolus, that is by the fibula, lower end of the fibula. This is the lower end. Now, you hold it like this. The posterior part, the groove here, and this is the articular, it articulates with the lateral part of the tibia, lower end. So, now you don't hold it like this. See, it has sharp borders, all these muscles. And see, this is the triangular area, that is the articular surface of the lower end of the fibula. And just below it is the groove. So you hold it like this. This is posterior, like this. It won't be like this, because it articulates with the tibia, lower end of tibia, to form lower tibiofibular joint. The upper end, this articular surface, the articulates with the lateral condyle of the tibia. बस हो गया. And identifying this is the lower end, this is globular more, this thing, big, this is small, and now you hold this in this group, you hold it like this. How to hold anatomical position? Okay, now you take a violin. Okay, you go to Rajasthan, people, they play that, क्या बोलता है उसको? Na 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 na, Ghana in Hindi, and previously in Posh Mela, the small earthen, this thing, these people used to come. It's a small, you can, baja, baja. Now, this is the part, how you hold it, and also see the ligaments. See. All that ligament is supporting and that action. आप अच्छा dancer हो तो you practice, you know. I love dancing. So naturally it's an exercise. Now maintenance of the transverse arch, shape of bones where shape it, intersegmental ties, deep transverse ligament, tie beam, tendon, tendon of peroneus longus, and tibialis posterior. Suspension of posterior tibialis, posterior brevis, lateral side and on the medial side. Now maintenance of the transverse arch. You can see the peroneus longus and brevis, peroneus tibialis posterior in the under surface. Putta deve. It is in this view. It is the so you can see the tibialis posterior. This is the peroneus longus, peroneus brevis. Now clinical normative, pes planus, flat foot. A boy or a girl, the mother comes and complains, doctor, please see, her walk is a bit different, her gait is a bit different. So it's like that if you like you can see the print of a normal foot is such, and print of flat foot is this. And metatarsalgia, pain in metatarsal region of the foot radiating towards the toes. Now the complaint of the flat foot is pes planus. Then what you have to do is that you suggest for some shoes for flat foot or pes planus. The inner side, there will be a sole, inner sole. Previously, we had to order these shoes. Nowadays, you have to depend how much flat it is, how much the arch is distorted. So accordingly, you have to, there are orthopedics appliances shop, you have to prescribe that. But for if you a bit means it was ignored, and then you have to accordingly you can give or any person is complaining of pain, then you get silicone inner sole or heel. To pain hoche, hatte pain hoche. So you in these conventional shoes, you put that silicone heel or silicone inner sole. So the arch is maintained, and you give some analgesic and some tablets, vitamins like neurology, you are mostly using neurobind foot or something like that. So that's one thing. Another thing, you add on a calcium, because see, placebo is a therapy also. Placebo, जैसे बोलते हैं ना, हमको एक माला पढ़ लिया. How it works, it doesn't know, but this is Om Shanti. That is also a treatment. That's why you go to some guru, Baba, they do jadoo, hypnosis or anything, and they give you some charm. एक charm दे दिया, एक पुष्पा दे दिया, not Pushpa 2. Okay. Now, what I want to say is that you have to definitely, you are a physician, you are a doctor, you are an orthopedician, you have to diagnose clinically. You ask the child to walk. If your cubicle is small, then you go out in the veranda, in the corridor, and you stand and you tell him to run, tell him to walk. That I do. Personally, I do that. So you can see his gait like this or this like this or like this. Whatever it is the or he's walking like a duck. Who dances? The famous dance, and he's a famous man. It's of UP Gharana. Kathak dancer. Who's the Kathak dancer? Biju Maharaj. Okay, Biju Maharaj's Shishya, Shashwati Sen. I had the opportunity to see this in Netaji Indoor Stadium. A big program with Ravi Shankar. That night was a stars-filled night. Ravi Shankar, Allah Rekha, Zakir Hussain, then Biju Maharaj, Samta Prasad, Tabla, then Shashwati Sen, this Kathak dancer. So you see in your this thing, your mobile, how Biju Maharaj is walking like a duck. Okay, that's a really, though the gait and this thing I want to impress is that the footwork of a footballer, the footwork of a dancer, it depends on the anatomical movements and the anatomical relations of that person's foot. Now this is the, and I would ask you, a famous artist who used to go most of the times barefooted. He was a poster painter of these big signboards in Bombay, and he used to draw these. Abhi to flex ho gaya, digital printing ho gaya, but they used to climb up bamboo scaffold and they used to draw that. Even they had their footwork, but I'm telling you, M.F. Hussain, you look into the Googles, he used to walk most of the time without shoes, and his signature was a big brush he used to carry. He's gone to London, he's walking barefoot. That's a different component. Now, you see Ronaldo, his famous Messi, footballers, Pele, all these people, they are having their footwork. So, billions of dollars they are earning with their footwork. And now, previously when I told you, anybody, you will see a girl or a boy who's from since birth, he didn't have the upper limbs. So they practice with their foot, and they're doing painting, foot painting. They are doing schooling. That means one thing, that the hand, the prehensile mechanism, and the foots you can train. Even see, if a thumb is amputated, then you can do a group of surgeons working for 13 hours or 12 hours to transpose the great toe and put it in the thumb and do these reconstructive surgeries. So they can use it, you can use it. Om Shanti. You hold it. Now that's one thing. Another thing is that now you see the video on your lower limb tibia, muscles and this thing, the tendons. Please see. Please carry this video home. If you have not taken it in your pen drive, please take it, because see, it is winter. You have a whatever dinner you are having, I don't know, but you think this is the best food you are having. Because when you become a doctor or in a hospital, you don't have any routine. You have to run. So when you are earning, even you cannot take good food. So you just enjoy and see the video. When you after dinner you sit together and you view this in the laptop or something. It is a wonderful book, because দেখো একটা কথা বলি, but I want to stress, এই দুটো lower limbs এর bone. Okay. Now this is the linea aspera. Now what you are doing, you just you are trying the muscle attachments in the linea aspera. Medial to lateral, lateral to medial. The adductor canal. These muscles. And this thing, you just put your hand like this. Even we are doing this is this, this is this. But why this video, what this video will give you is that they are plasticized dead body. You will be seeing in your prosected dead bodies in the dissection hall. Your teacher will demonstrate or by lifting up a tendon or a muscle and say this is tibialis, this is this, whatever it may be. But when you are viewing, you having a narrative, the teacher, his narrative, he's narrating the whole chapter and saying that the muscle is this, then this is swing, the muscle is pulling. Hallucis longus, muscle, this is plasticized, the tendons are there. But over there, whatever it is, you get an idea that the muscle looks like this. The tendon is going in the anterior compartment or posterior compartment or in the gluteal region. But in this, you will get a demonstration of the how it is being pulled.